What to expect when discontinuing extended-release naltrexone. In this telehealth visit, a doctor and patient discuss the process of coming off extended-release naltrexone and important considerations.
Okay, so we've talked about some of the reasons that you want to stop your medicine and some of the pros and cons of that. What other questions do you have for me now?
Yeah, I have one other question. So how does coming off the medicine happen?
Good question. So you're on long-acting naltrexone, which is not an opioid. It blocks the opioid receptor. So you don't need to lower your dose. The way we'll stop the medicine is we just won't give you your next shot. And then as time passes from the last shot, the naltrexone levels will decrease in your body slowly and eventually go down to zero and not be active anymore.
And how am I going to feel? Am I going to feel bad? Am I going to feel in withdrawal?
So you shouldn't feel any physical symptoms of withdrawal because naltrexone is not an opioid. It's not acting on the receptor like an opioid. Um, At the same time, I just want to warn you, you may not feel withdrawal, but there can be some psychological changes when you stop the medicine. Um, all the time while you're getting the shot, you know that if you use opioids, they wouldn't have any effect on you. So maybe you haven't had any cravings recently. People sometimes say that once they decide to stop taking the shot, the cravings return because they realize that there's a chance that they can use opioids and get high. So your cravings could return in that way, and it's just something to look out for.
That's good to know. Anything else I should know about?
Yeah, one thing I definitely want to talk to you about is that when you're coming off of Vivitrol, it seems like it's relatively easy. You just stop the shots and you shouldn't have any withdrawal. But you should just remember that addiction is a chronic illness, and as AA says, it's a cunning, baffling, and powerful illness. You know, you may think everything's better, I'm cured, I'm good for now, but as I mentioned, be careful because sometimes cravings could return and they could return unexpectedly, and it's good to just be prepared.
This sounds hard. How can I make this as easy as possible for me?
Good question, and I'm glad you're thinking about trying to come up with a plan beforehand. So, you know, I think some of the things you can do to help yourself are try to have some support people available. If you know something happens, God forbid you start getting cravings again, or you're in a crisis, have some people you can call on, and you know, preferably more than one in case someone's on vacation or not available. Um, that you can give a call and they can talk you through it. Also, just between for yourself, having some things ready just in case you start having cravings or you start questioning whether you want to continue with your in your recovery. Have some things to remind you of the reasons you started. Some maybe inspirational messages, goals that you have, pictures of loved ones that maybe you want to stay in recovery for. Um, Another thing you can try is having something to distract you, like a funny video or movie that if you know you're going to get a craving, well, now I can always go to this and it will distract me and I'll forget about it. So all those are different strategies people use, to prevent a relapse, and those are all good things to have in place.
That sounds really helpful and makes sense. But also, I heard about some people who thought they were okay, but ended up going back to heroin and overdosing.
Yeah, I'm really glad you brought that up actually, because that's an important concern. Um, an important thing to remember in this process is that since you have not been using opioids recently, your body is really back to the way it was before you started using. Um, Once you stop the naltrexone, you're no longer protected from an overdose. And if you do go back to using, God forbid, uh, you're certainly at high risk for having a problem and possibly an overdose and death. If you would go back to using, I would say make sure to do it really carefully and keep this in mind. So act as though you've never used opioids before. Use a very small amount, and don't assume you can go back to the amount you used while you were actively using. So another thing you can do, because you never know what's going to be in the drug supply these days, have someone around with you with naloxone available or Narcan available, so that if you have a problem and you have an overdose, they'll be able to give it to you and bring you back. I can write you a script for the Narcan, the naloxone, or you can get a free kit from the staff. Even if you never use it, which hopefully you never will, won't be relevant, it's just good to have available, in case a friend or someone ever has a problem. So yeah, good to have around.
Yeah, that would be great. I appreciate it. Thanks.
All right. So I guess that's probably we've probably talked about pretty much everything. So I just want to reiterate. So we'll go forward with this plan to try to stop the shots. If you have any problems, you can always reach out to the clinic. Reach out to myself or someone on the staff and let us know. We'd rather know earlier rather than later if things aren't going well. We can always revisit this decision. But if not, I'll see you next visit, okay?
Sounds good. Thanks.
Great. Take care.